Hi, Dr. Gullberg here, continuing our infectious disease lecture series. Today we're talking about gastroenteritis, a very common problem that we see in the clinic setting as well as in the hospital. Gastroenteritis is when there's an inflammation of the GI tract causing usually abdominal pain associated with nausea or vomiting and diarrhea. Basically, I want you to break this down into three areas. I call it the triple threat of attack. First area is the non-invasive but toxic infection. These patients have either cholera, which is a voluminous diarrhea treated with tetracycline. Of course, we don't see cholera in the United States, but it's seen in many countries all over the world. Second is enterotoxigenic E. coli, which is otherwise known as traveler's diarrhea, treated with multiple different medications are effective, including doxycycline, ciprofloxacin, rifaximin, those types of antibiotics. Third is Staph aureus. Fourth is the Bacillus cereus organism. All of these organisms then are able to cause a significant often toxin-related gastroenteritis. The second area is what I call the ileitis colitis syndrome. The most potent organism here is Shigella. It only takes one Shigella organism to cause just a big mess and significant inflammatory reaction in the GI tract. Causes often, obviously, a bloody diarrhea, high fevers. There's different serological types. Can cause bacteremia, that type of thing. Very sensitive generally to quinolones. The other organism that we saw much more commonly in the 80s and the 90s is Campylobacter. Campylobacter is associated with undercooked chicken, can cause bacteremia and sepsis syndrome. Treatment, of course, is macrolides. The third organism associated with ileitis colitis is Yersinia enterocolitica, more commonly seen in kids, but certainly have to think about it. Fourth being invasive E. coli. 6% of these cause hemolytic uremic syndrome. The fifth then is Salmonella, primarily the non-typhi strains. So remember all these organisms that are authors of ileitis and colitis. The third area of the triple threat of attack is organisms that are able to actually transverse the intact GI mucosa. Primarily, we're talking about Salmonella typhi, which can cause septic shock and death. We have to watch for carriers in this disease, especially in those who have gallbladders present or who have gallbladder disease. Other organisms that can do this are parasites like Giardia, Cryptosporidia, and even viruses like norovirus. So the triple threat of attack of gastroenteritis, the non-invasive but toxic, the ones that cause ileitis and colitis, and finally the organisms that are able to transverse intact GI mucosa. Nice summary for you for gastroenteritis. Thank you. Dr. Gullberg signing off.